Welcome to our next interview in our COVID-19 Connect series. I'd like to introduce Dr. Michael Liebenstein, who has been with CHE for 7 years, since 2013. So thank you so much for your long-term employment with us. And you are a clinical health psychologist. You're board certified in biofeedback, which is pretty awesome. But one of the reasons I've invited Michael to speak today is because you've had a pretty unique experience. I want to share different experiences across our different regions, and you're coming from New York, New Jersey. You are working in buildings in both of those regions, which had a very different and pretty devastating experience early on during the COVID-19 pandemic, because it hit quick and fast and the state really wasn't prepared, and we just saw really high numbers in nursing homes and across the state. And so I really wanted to talk to you today about your experience in New York and New Jersey and what it was like for you when the COVID outbreak first started. And also added to that, this was a time where you were just transitioning to new facilities, just working in some newer buildings, keeping some of your old, but working in some newer buildings right when this happened, which it's hard enough, all of the extra time and resources and energy we put into building rapport and getting our system set up. And now you have to try to work with staff and maybe not staff being there because of the COVID-19 pandemic. So with that said, I just wanted to start by asking you to just share a little bit about, what your experience was like right when this kind of occurred, and, just whatever comes to mind for your experience really in, March and April.
Well, thank you, Dr. Birdsall, for this opportunity, and I appreciate the opportunity to share my story. It's certainly a unique experience I had over the past several months. As you mentioned, I was in the process of transferring from New York solely to New Jersey, and that's right when the pandemic decided to hit, so it made that transition extra challenging. I was all but transferred out of my New York facilities and just starting in my New Jersey facilities at the time when the cases really started to balloon. And so it was challenging because I didn't really get to have some formal goodbyes at my other facilities in New York. And I was maybe just a couple of weeks in at some new facilities. And it was tough because there was a lot of panic, a lot of fear, not just on the part of the patients, but on the part of the staff. That was right in the heart of when we had some PPE shortages. I remember saying the virus really was changing by the day. And every day there was something new in the news. And we were all wondering when and if there was going to be lockdown orders, which shortly came. And so it really was a turbulent time. And I was just about getting my feet wet in a few new facilities. And that's when I got sick and I contracted the virus. My symptoms started out as mild. Overall, it was about 8 to 10 days of a mild flu, I would say. Some bizarre symptoms, but overall, I was able to recover fairly quickly. I was in contact with my personal physician and trying to get cleared as soon as I possibly could to get back to work. I did my normal 2 to 3 weeks quarantining, and ultimately, when I was cleared, I was ready to get right back to work. And
you got COVID, got sick, got better after 10 days, and went right back into the facilities.
Pretty much. Yeah,
pretty much. To maybe relieve some anxiety for some of our providers. I know, for example, like in California, we have not had a single provider who has contracted COVID, even in buildings where we have positive COVID cases. I think we had a lot more time to prepare and for our facilities and staff to start using PPE and really getting a lockdown on infection control before the virus came to California. Do you, thinking back to your experience and having contracted COVID, was it in March for you, kind of early on?
Right at the end.
Right at the beginning. Do you think that was more just from the experience that we saw in, those kind of Northeast states where it just spread so quickly before any real policies and processes were in place around PPE and those kind of infection control procedures?
Yeah, there was certainly a lot of infrastructure and resources in place now that we didn't have back then. So as I was mentioning earlier, things were changing by the day, and we just didn't know how to approach certain things in the nursing homes. And um, a lot of us were looking to the CDC for guidelines, and still do to this day. But it would change week by week in terms of the restrictions, the ISO units, and certainly one big challenge was there was a lot of patients changing rooms. And so that was obviously a little challenging when I would come into the site and I would have to go through the roster.
For you in New York with, you're in a number of different buildings. Some you were in for a while and some were brand new. So you're trying to, establish yourself, establish a routine, connect with staff, all the good practices that we do to get our services kind of up and running. What was that like, working with the staff in New York, New Jersey? Can you tell us a little bit about your experience of how they were impacted or responding to the crisis? What was it like trying to connect and communicate with them? Just maybe share a little bit more about that. I imagine it was pretty difficult at that time.
Yeah, it was definitely challenging. One of the first big challenges was that we all wear masks. And when I'm in new facilities, I'm trying to learn faces and learn names, and everybody's wearing a face shield and all the
I didn't even think about that, Michael. I did not even think about that. Like even them connecting with you, but how do you even remember people or their names? You can't see them.
Exactly. There was definitely a lot of staff not on site, especially staff that I find that are integral to our work, which is, social work as well as recreation. I often incorporate that as part of the treatment, as part of the care. So we're trying to just improvise, but as we mentioned, it's definitely improving compared to where we were several months ago.
Great. Did you find with the staff that were on site, if you need to follow up with someone, like go to, the nurse's station and talk with a charge nurse, were people receptive to you, or did it seem like everyone felt you were just like, leave me alone, I'm in crisis, like don't even try to come talk to me right now? I imagine that you may have gotten some of that. Like was it hard to kind of build rapport, build relationships at that time?
Yeah, I just, tried to be a presence, just try to make myself known who I am. I sometimes introduce myself multiple times to different staff members. It was important to let them know that we are here to help, we are working as a team, and also to let them know that we are here for them as well. And we've had a lot of staff members that have conveyed stress and fatigue and burnout to me personally, even some recreation staff. So I was happy to point them in the right direction in terms of getting some sessions with CHE doing telehealth. Certainly some challenges there, but we try to just create that team atmosphere amongst.
I love how you're responding to my questions, by the way. I'm like, tell me how difficult it was. And, staff must have been just not wanting to even bother with you. And and you're like, well, this is what I did, right? So I was very supportive and I just kept introducing myself. So I love that, whatever I'm throwing at you in terms of tell me about how hard it was, you're just letting me know how you figured it out and rode the wave and made it work, which is pretty impressive.
I guess that's my positive thought restructuring, kicking into gear.
That's good. So, a few times you've actually mentioned, how things are now and we've come a long way, or recreation, social workers, they're back, they're on site again, things are different. So I'd love to just hear, it's 4.5 months, over 4 months since this started. What's happening now? Are things better? Have they improved? What's changed, if anything, in your facilities? We obviously, as a country, globally, we're all still dealing with COVID. Here in California, the cases are on the rise again. So it's, we're not away from it. We're not out of the woods yet, but what's kind of been the atmosphere now, 4 months in?
In leaps and bounds. We have a lot more staff back on site. That is very noticeable. And I would look to these little things week by week when I would return to each site that maybe I was at 1 or 2 days a week. So little subtle improvements. So staff being back on site, having more recreation staff back on site, more of the social workers back on site. It's good to see. There's, I think, a little bit less fear, as well as people a little more energized. We have some new faces with staff as well. So you have some new workers coming in, but like I said, we still try to emphasize the team atmosphere. So definitely more staff has come back. There are less patients in the ISO units, less positive cases. I actually also, I'm happy to report that I donated my plasma twice.
Wow, that's amazing.
So that kind of gives me the ability to not have to worry about testing positive again.
But what are they using your plasma for?
So the plasma is being used as an infusion for patients who have the same blood type. And it is essentially almost within 3 or 4 days, patients are recovering, and I wouldn't say symptom free, but maybe out of the ICU and on their road to recovery. So that's the best thing we have right now for treating these patients in the hospitals. So if anybody did test positive, I encourage you to go through the Red Cross and look up options for donating your plasma. There's even organizations that will pay you for your plasma. And despite all of that, one of the most gratifying moments I had during all of this was I received 2 emails saying that my plasma was given to patients. And it feels so good knowing that, this could have helped save a life or 2. So yeah, I'm getting ready to schedule my 3rd donation. So I encourage everybody out there that may have tested positive or has antibodies to please donate. I think that would be a great way to give back.
That's amazing, Michael. That's so cool. Thank you for sharing that. That's really special. Michael, thank you so much for your time. Thank you for your commitment. It's just amazing. And, for sharing your experience, for actually being one of our providers that, did have COVID and, kind of went through that process, just like the patients and the staff, and then got back into the buildings. It's really important to hear experiences from different regions. We've all I think there's been different waves and different experiences. So I think this is really, really helpful. And donating your plasma is just so cool. I mean, that's just so awesome and so generous. So thank you so much for all that you've done.
Thank you for listening to my story and taking the time to hear my experiences. And again, I'm glad that we're all able to connect and support each other as we are dealing with these unprecedented times, but it's getting better.
Thank you.